I mean, St. Louis, if you look it up online, it's one of the most segregated cities in America.
We pay over 40% of the city budget for the school and for the police, and you hire trash.
My ex-husband is a school teacher. Year after year there's shootings, and it's like, when is it going to be his school and what's going to happen?
Shots fired!
And that's a terrible feeling.
The city didn't see any need to really develop that area because it's the area where Black and brown people live.
Just boom, 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 boom. I watched the blood and him cool to be undifferentiated.
Many people always say that, Hurricane Katrina was like a natural disaster, but it was very unnatural in its impact and in its follow-up.
That week alone, before killing St. John God, 8 people died. They died in my arms because I had no more Narcan.
No te tratan como persona, te tratan simplemente como un negocio. Simplemente somos un objeto para poder obtener dinero.
Nueva York, lo único que tiene de Walt Disney es que la mamá de Mickey te pasa por los pies.
In order to qualify for Medicaid, you have to make less than about $15,000 a year, which is basically the amount of rent for a year at most places in the city.
We know that the health care would be too expensive, and we would have to live paycheck to paycheck in order to pay for our medical bills.
I just hope I never get to the point where I have to go to the hospital because that's really expensive.
I currently have Lyme disease in remission, and the basic effect of that is that I have to be constantly aware of my own health, and it prevents my body from naturally healing from other sicknesses to a significant degree. And I'm uninsured. At this point, becoming insured is out of the realm of my financial possibilities, and I'm trying to get covered under Medicaid at the moment. In order to qualify for Medicaid, you have to make less than about $15,000 a year, which is basically the amount of rent for a year at most places in the city. So basically, it's not feasible. As an uninsured person, I'm constantly hyper aware of my own health problems, and I can't predict. And there is a constant worry about if anything else were to happen, I'm basically without any tool to facilitate my own health.
To try and get subsidized health insurance, I went to the county office, Health and Human Services, ended up filling out a lot of paperwork, and then was told I would receive contact from them. And I was contacted several times with misleading information, some saying that I would get health insurance on one specific date, others saying that I did not qualify for that health insurance, and then others saying I would get it on another date. I'm still working with that online and in person, and it would just be nice if I could have one place to go to or have some more concrete clarification as to what I'm eligible for.
I'm a breadwinner for a family of 4, and I do not have health insurance. I was a teacher and I had health insurance, but now I found myself uninsured since quitting from teaching, and it's been difficult to find affordable health insurance, and that's something I have to worry about with me and my family moving forward. Doing freelance work doesn't always put enough money in my pocket so I can seek health care when needed, because it can be pretty pricey. To apply for Medicaid, you can't make more than $1,200 a month. Unfortunately, I do make more than that a month, but I'm not old enough at the same time to apply for Medicare to be 65. So the private health insurances that run that gray area in between are just too much a month for me to afford health insurance for me and my family. So God forbid something happened to me and my children, we know that the health care would be too expensive and we would have to live paycheck to paycheck in order to pay for our medical bills. Every bit of our paycheck that goes towards my own health care expenses takes away from what my children and my wife would need if something were to happen to them. So it has been difficult. Between the payments of my own medication and where I currently live, and to put my kids in a good school, there's not much left over at the end of the month. If I could change one thing about the United States healthcare system, it would be the price of life-saving medications. These pharmaceutical companies in the United States price gouge the average American who does live paycheck to paycheck, people who are already struggling, and that should not be the way it is for people who need these medications to live.
I was first diagnosed with asthma when I was 3 or 4. I have to get an inhaler, and that's after insurance like $35, which is crazy. And that's after going through a bunch of different ones, trying to find the cheapest one. And that's just one of multiple medications. I just hope I never get to the point where I have to go to the hospital because that's really expensive. But yeah, generally in an emergency, I'll do anything I can not to have to take an ambulance because of the expense. And I have multiple health things going on. So our yearly healthcare expenses are well over $10,000. We get 5 or 6 prescriptions a month, and it's easily over $100, and that's on top of what we have to pay just to be covered. After you take all that out of our income, there's not a lot left over.